Good afternoon and welcome to the regular meeting of the Public Health and Safety Committee for November 8th, 2023. I am Latricia Vita and I'm the chair of this committee. At this time, I will ask the clerk to call a roll so we can verify a quorum for this meeting.
Councilmember Wansley.
Present.
Rainville is absent. Ellison is absent. Palmisano.
Present.
Vice Chair Payne.
Present.
Chair Vita.
Present.
There are 4 members present.
Let the record reflect that we do have a quorum. With that, the agenda for today's meeting is before us. There are 8 items on today's consent agenda. Item 1 is accepting a grant from the Minnesota Department of Health to provide local public health services. Item 2 is authorizing a contract with City Match for work on the Healthy Families Community-Based Perinatal Health Initiative. Item 3 is authorizing a contract with Helix Health and Services for temporary housing, substance use disorder treatment, and mental health services. Item 4 is authorizing a contract amendment with the Minnesota BCA for the Sexual Assault Initiative KIT grant program. Item 5 is authorizing a contract amendment with the Sexual Violence Center for the Sexual Assault Initiative KIT program. Item 6 is authorizing an increase to a contract with the Hennepin County Attorney's Office for the Sexual Assault Initiative Grant Program. Item 7 is setting a public hearing for November 29, 2023 to consider an ordinance amending the high-risk sexual conduct language to remove stigmatizing language. And item 8 is setting a public hearing for November 29, 2023 to consider an ordinance amending the Neighborhood Revitalization Program Policy Board. The first thing is item 3 has a revision, and I'm going to ask for staff to please come up and explain the revision. Thank you, Louisa.
Council Chair Vita, Co-Chair Payne, and council members, the revision is to increase the amount of funding from, I believe it's 910,000 is what's listed, to 999.
650.
650. I think I don't have all of the details, but there was a discussion between the mayor's office, the contractor, and Deputy Commissioner Ritchie, and it's increasing. Some of the costs are due to adding some treatment pieces and some administrative costs for Helix.
Thank you. And I'll just add that Deputy Chief Ritchie added in the email that was sent to me that this increase is due to revisions in the substance use treatment portion of the project, specifically around managing the program and contract. They've added a number of reporting and metric requirements to the contract, and the original proposal has grown as from an initial housing and low-intensity treatment to housing and wraparound services with a high inpatient treatment component, hence the additional expense.
And we added the metrics to the contract.
Thank you. Thank you. Is there any discussion on these items? So seeing none, I will move approval of the consent agenda, including the staff's recommended revision to number 3. All those in favor, please say aye. Aye. Any opposed, say nay. That carries, and the consent agenda is approved. The next item is receiving and filing a presentation on the work of the Maternal, Child, Adolescent, and Reproductive Health Division in the Health Department. And here to present is Louisa. Good morning, good afternoon. I'm sorry, welcome.
Good afternoon, Chair Vita and Co-Chair Payne and council members. And starting the presentation will be myself, Stephanie Graves, and I'm the manager of the Maternal, Child, and Adolescent Health Division. And it's my pleasure to be here today. Just want to give you a little bit of background. You'll see we're going to start with our team, our Maternal, Child, and Adolescent Health team. We've got pictures of everybody, but most of them here in the audience this afternoon. And, you know, it's a diverse group, and diverse in more ways than one. We have cat lovers back here. We have chocolate lovers. We have shoe lovers, you know. We have, you know, diversity in more ways than one, as I mentioned. But the one thing that we all have in common is that we all care about the families in Minneapolis and want our women and children to have healthy lives and healthy birth outcomes. So our goal is that all Minneapolis families thrive by reducing disparities and ensuring equity. Our maternal, child, and adolescent work overview will include kind of a quick recap of our home visiting programs that we fund, and then which also includes the prevention of infant mortality. We'll talk about school readiness. We'll talk about the immunization work that we do, which includes education, outreach, in our clinics, and then the reproductive and sexual adolescent health and our youth development. And as you see with the family home visiting services that we provide is in partnership, with Hennepin County. It previously was partnership with MVNA, but in 2022, Hennepin Healthcare decided to no longer have MVNA as one of their forward reaching community partners. So they decided they would no longer have it, and we in Minneapolis at the health department wanted to bring that program internally, but the decision was made to provide the services through Hennepin County. And the provision, then we started in January of 2023 with partnership in Hennepin County. The contracts value at about $2.3 million per year, the funding that goes to Hennepin County to provide those home visiting services. The programs emphasize reaching families with a history of child abuse and or neglect, tobacco use, or live in a home where tobacco is used, and have mental and or substance abuse issues, or have low student achievement or without high school education. So a lot of the social determinants of health that we look at to see how can we possibly intervene or help them move along the continuum to have a better life and better health care. In addition, the Minneapolis Health Department received additional funding from the state, which is to work on what's called a promising practice type grant with the Division of Indian Work to support in the development of a culturally specific home visiting curricula for Native American families that incorporates traditional practices and supports families impacted by substance abuse. So the data for evidence-based home visiting, as you see, between January and June of 23, 789 families, 1,326 individuals were served out of over 4,000 home visits conducted. Those that were served, over 80% of those were identified as BIPOC families. They speak many languages other than English. And the MVNA, which formerly MVNA, the Hennepin, the nurses, we have nurses that speak the multiple languages. And if they don't, they have a service that they can tap into to be able to serve the families from their known language. We over 40% of the visits were follow-up to children and issues such as asthma, lead, and other pediatric concerns. And then the second most common type of visit was postpartum, which is about 28%, and then parenting and antepartum, which is during pregnancy, if there's concerns that they need to be followed up on. Over half of the referrals come from at the time of birth. For our school readiness, as we know, early childhood intervention is important. And we partner with a couple programs, specifically Way to Grow, which I'm sure many of you are familiar with, and they do fantastic work. We've partnered with them for many years to ensure that they're reaching families, especially in neighborhoods such as Phillips, Powderhorn, and near North. And they do a lot around, they provide child education, health education, nutrition and safety, and other support services. They also include teen parents and immigrants and single parents and families living in poverty. And then we also partner with Minneapolis Public Schools with their early childhood screenings, and they specifically target for us, Minneapolis Health Department, they target African American and American Indian families because those are the two groups that have the highest disparities. So that's what we ask. They don't turn anyone away, but they do target those specific populations. And with the Vision Health, they have also been able to find out there's a new program that we've been working on for a couple of years where they're able to use, it's an instrument that can detect other vision besides the normal screening that is done in school screening, so that they can see that they might need some other services, and they've been able to identify and then refer those children on for other services and get it corrected. All right, and then I'm going to turn it over to Louisa. Thank you.
Thank you, Stephanie.
Thank you.
Thank you.
And I'm filling in for our immunization coordinator, who is in sunny California celebrating her birthday. So I'm Louise. I'm the Director of Public Health Initiatives for the Minneapolis Health Department, and I have the pleasure of working with this wonderful team. So I'm going to talk a little bit about our work in immunizations, which has been focused on bringing clinics to areas where we know immunization rates are low and where access is more challenging. And so we've partnered with the Family Partnership, A Mother's Love, and Partners in Prevention to have monthly clinics where we're offering COVID vaccine, flu, and Mpox vaccine. And these are some of the pictures, mostly from clinics that we've done over the past year. We work with mHealth Fairview as our vaccinators, and also with Cook Clinic. So as I mentioned, we've focused mostly on adult vaccinations around COVID, flu, and Mpox, partnership with BIPOC, culturally specific organizations, and in zip codes where we know we have lower immunizations. Our outreach and education team has been reaching out and serving the community in those areas, and within their words, being in the community and providing a service by meeting people where they're at has made such an impact. Figuring out where and how I'm going to get my vaccine can be difficult to navigate in the communities we serve. By being present, we have been able to educate and answer questions about staying up to date on vaccines, as well as helping folks to try to take control of keeping themselves healthy and their loved ones. So that is specifically what they're doing. And some examples of the work that we've done in terms of education, we've been to cultural radio shows such as La Haza, Oromia 11, Sora Media, KMOJ, WIXK, provided information and had some call-in shows. And we've also done some communications campaigns, and I'll show you some pictures of those. We did some back-to-school events and are looking at how we can work with MPS to help them get the rates of immunization higher for our young residents. So here's some of the vaccination data on the clinics that we've done. To date in 2023, we've had 47 clinics giving over 1,400 shots between COVID, flu, and Mpox, and over 50% of our COVID vaccinations have been to members of the BIPOC community in North Side and Phillips, Powderhorn area at the Family Partnership. These are some of our communication campaigns. You might have seen it on Facebook or Twitter or X, as it is known. Also, we've created posters that our community partners can use. We had a whole Why Get Vaccinated, where staff actually got pictures of their kids, and so these are actually friends and families of the staff, and saying why they get vaccinated. So importance of childhood vaccination, and also information on how to stay up to date, or why it is important to stay up to date. These campaigns have been done in collaboration with our communications team at the health department, as well as city communications and our epidemiology team. And I'll now turn it over to Sarah Sheely to speak on the reproductive and sexual health. Thank you.
Good afternoon. I'm Sarah Sheely. I'm also with the Maternal, Child, and Adolescent Health Team, and so my role is youth development and sexual and reproductive health for our division and our department. So the adolescent sexual health work is done through supporting community-based organizations and clinics that work directly with young people. We do this so that we can reach young Minneapolis youth that do not go to Minneapolis public schools and therefore don't have access to our school-based clinics. We fund 2 partners, Family Tree and Hennepin Health, Between Us programs that provide STI testing and education that is focused on serving youth of color because we know there's a higher disparity among them. We also fund the Annex Teen Clinic and Planned Parenthood to provide sexual health peer education programs to youth. Another way that we do our work is through collaborative efforts with other youth sexual health organizations to ensure equity and access to reproductive health care and education. The Minneapolis Urban Initiative, also known as MUI, is a collective of organizations and clinics that meet regularly to assess what's happening with youth in Minneapolis around sexual health issues and then work collaboratively to address those issues. We also coordinate and lead the annual statewide STI testing week for youth, and through that we provide technical assistance and resources to clinics across the state to offer free STI testing in their clinics to youth. One of the newer areas of my work is the Reproductive Health Access Fund. So as you all know, the mayor and council approved one-time funding to increase access to reproductive health care. We funded Hennepin Health to develop a system-wide workflow for coordination and comprehensive abortion care across all 9 of their clinic sites, and to provide support and that continued care coordination for a year post-pregnancy termination. We also funded BRAVE to promote health education and access for Somali women, including healthy relationships and gender equity through a peer mentorship model. And WellShare was funded to identify gaps in sexual health materials and messaging relevant to refugees and to co-create educational messaging and materials with young people to increase access. Minneapolis Fast Track is our HIV work. It's a global initiative to end HIV by 2030. We signed on to become a Fast Track city in 2018. We maintain a Minneapolis dashboard on the Fast Track website that has our local data. And then I sit on the Minneapolis Council of HIV Care and Prevention and co-chair the Eliminating Disparities Committee for that work. We are also currently working on an amendment change to remove stigmatizing language and outdated health information about HIV and AIDS. And then youth development. And I believe the Youth Coordinating Board was here not too long ago, and I work very, very closely with them on the youth development work. So it's done in partnership with the Youth Coordinating Board. We provide funding for after-school youth programs that happen through the jurisdictional partners. So Hennepin Libraries, Minneapolis Park and Rec, Community Ed. We also co-lead we actually lead the CFCI recognition process that's been happening for a couple of years, but Youth Coordinating Board definitely helps with the project management support on that. We provide staffing support to the internal youth cabinet at Minneapolis and provide support to Minneapolis After School Network and assist youth workers with professional development opportunities in partnership again with the YCB. And that's it. So thank you so much for having us today, and we welcome any questions.
Thank you all so much for this presentation, and I see we have Councilmember Payne.
Thank you, Madam Chair. Yeah, I was just curious how this body of work integrates with our, or if it integrates with our school-based clinics, and how we might strengthen the relationship with MPS.
Chair Vita and Councilmember Payne, what we do work kind of closely together, but they're just so like in the schools. So one way we're working is in partnership with Community Ed and the University of Minnesota PRC Prevention Resource Center. And we're in discussions right now about the possibility of supporting middle school sexual ed curriculum that would be taught through community ed. So it would be, youth, middle schoolers that are in after-school programs, and their parents could sign up special for this type of sex ed. I'm trying to.
I was going to add that we are working with MPS around immunizations and are looking at for schools, especially middle schools that are close to the school-based clinic in the high school, how we can extend the provision of services and allow middle schoolers to go and receive some services, especially immunizations, and also looking at how we can collaborate with MPS to create a system by where we're either assisting or connecting with the clinics that we also work with to integrate as a source for referrals, because as they've had lots of newcomer students come in with unclear immunization records to try to up that piece. So there is a lot of collaboration between this team and MPS as well in other areas.
Thank you.
Thank you. Councilmember Wansley.
Thank you, Chair Vita. I just had a question, two. One being around always interested in seeing how we're creating metrics of success. I see a little bit of that provided for the HIV response that was guided by the fast track provisions, but wanted to see if some of our staff could speak to some of the metrics that you're using for maternal health, especially in knowing that there is racial disparities as to how I'm going to name Black women and other women of color are dealing with those particular issues, especially around infant mortality rates, and also even around reproductive health and immunizations. Struggling today. Even in our current landscape right now of, are there gaps of services and how we're looking to approach that? So was excited to see those metrics for some of our HIV work, but just wanted to see if the two other areas had those metrics present too.
In terms of the metrics for some of the funding that goes out, I can get that for you. I didn't add it in today, but I can definitely give some reports back on the organizations that we fund and kind of who they're serving. Again, with the two, with WellShare and between us, it really is focused on youth of color because, again, we know that those are higher. And I'm actually not the contract manager, but she's sitting behind me. So I don't know if you have anything to add to that? No? I'm looking at Aaron.
I can also speak to some of, the immunizations. We are definitely looking at the rates of immunization. I mean, there's only so much that we can impact. We are doing education and outreach because we know in looking at the rates of the coverage rates that we have significant disparities and we have low rates across the board. So we use the state data from the immunization registry to really guide our work and look at where the gaps are. In terms of for family home visiting, there are very specific, there's a specific population that is being served, and that is also guided by what we see with our disparities in infant mortality and in outcomes, birth outcomes for different communities. So we are focusing on teen moms, families with substance use issues or previous child abuse. So those are some of the targeted areas. And then there's metrics around how long a person stays with services, the metrics around the health of the child and meeting certain, and Stephanie can probably speak to more of the particulars, but all of those are also defined by the programs that are being implemented. So these are the evidence-based programs that are being implemented for family home visiting. I don't know if you had something.
Thank you for the question, Councilmember Wansley and Councilmember, or Chair Vita, Co-Chair Payne, and council members. I also want to just add that we know what the disparities are and the rates, and they haven't, especially when it comes to infant mortality and now the rates of maternal mortality in the African American community as well as the American Indian community, rates have increased. And so I think it's even more important that we pay attention to what is going on in Minneapolis with our women. So we do participate, for some of us, we participate in the birth justice group that's happening with Minneapolis is included, and Hennepin, and then other players that serve women in the communities that we're talking about. And it's specifically looking at what's going on for our communities. How can we improve, not just for the women, but improve the access and the resources that they're getting, because the changes aren't happening quick enough. Our babies and our women are actually dying. So what can we do? And the other part of being part of the state, the perinatal subcommittee, is to see on that level, trying to look at policy, and is there things that we can do and change in the healthcare systems that we know, perpetuate the institutional racism that happens. So we are aware of the rates, and we do try to look at different ways of how do we address it and how do we pay attention to say, here, what's going on, and we matter. We matter just as, the dominant society matters. So how do we make those changes, and how do we do it in a way that we're not waiting another 20 years? So, thank you.
And then just a follow-up question too, and knowing some of the trends with the home visiting or home-based visiting project, and this even relates to some of the maternal rates, especially as targeting teen moms. Are you seeing any trends around housing insecurities in particular? I know from experience of working with students or teen moms, that's often an area that I've seen as an issue that rises kind of to the top. And how does that also interact or interface with interruptions of services too, or how these services are being responsive to that dynamic that we know are also impacting communities, either experiencing HIV or also, growing families at a very early age?
Thank you for the question. The way that yes, there is trends, and the trends is that there are more young people they call it couch hopping, don't have secure housing and having either young infants or during pregnancy. And there is a new program that has Minneapolis Public Schools is part of, as well as the county that has started, where they have some funding to actually try to house the young people, especially when they're pregnant. And we are talking to them as well because of the home visiting piece, that we make sure that they have a connected support person that they can have. The other part that we try to do is we want to get them connected to a doula.
Oh, nice.
And we see that if they have, some support person, such as a doula, they're more likely to access resources and stay connected, because it's not someone that they don't see them usually as a government type person where they're in fear of they're going to turn them in, or they just want to, penalize them for whatever they're doing. So it's more of building relationships. And so we need more of that on that level, the community level, and we need people that come from our communities to be able to be there and, doulas, community health workers that can connect and get our women connected to services and access to prenatal care.
I'm really excited to hear about the birth workers or doulas, especially in like maternal health outcomes, knowing that has been a game changer
Yes.
and giving women of color additional advocates in very institutionalized environments that are not often responsive to our needs, while going through one of the most beautiful but also traumatic experiences
Right.
that honestly we're dying from. So if there's any way, like, as council members, I'm really excited to see how do we show up more in this work of like expanding birth workers. And we have such a rich community here in the Twin Cities of women of color stepping up into that space because they want to save us too.
Yes.
If there's any way we can support that work, advocate for it, put it in our newsletters, like please let us know. I'm really excited to hear that partnership be intentionally embedded in this work too.
Okay, I'm going to hold you to that one.
Oh, please do. Yeah.
Add that the City Match contract it's a grant that City Match received, and we are consulting with them, and that is to look at ways to engage these community providers into the healthcare system so that there's a quicker connection. And so that's part of looking at policies and looking at ways to change the system so that doulas and community health workers are more engaged even within the system, so that there's an easier transition between giving birth maybe in a hospital and then going home, but already that accompaniment is present in changing those policies. So that's a grant that came from the Office of Minority Health to City Match, and then they are contracting with us to be part of that policy development and looking at those issues. So we're definitely moving forward in doing some of that work.
Just a quick follow-up on that one. For the birth workers with that program, do you know if it's just during the pregnancy or are they also offering, because the postpartum piece is such a crucial component to this too, so yeah.
I
is it
think
both?
that and Stephanie, please come up here, but the work is to really look at how to better integrate those workers into the system from pre-birth through post-birth, so postpartum. So I think because right now there's some systems that are doing that, some systems don't, and sometimes you have to pay out of pocket
Yes.
for those services, and how can we create a system that's seamless and that everybody can take advantage of?
Awesome. Thank you so much. Super excited to hear about that work.
Thank you, Councilmember Wansley. I just want to say thank you all so much for your hard work and your commitment to this work. A long time ago, I worked to make sure that community health workers were an acknowledged profession, that they had a billing code for the services they provided. The model has always been important to me because those are the folks who are on the ground working with our families every day, really taking a holistic approach. So I love that you all are keeping that model alive. It was something that could have easily been buried in public health. So thank you so much for doing that. Thank you for your commitment to our families. This work goes a long way. A lot of these things, we just can't see it with our visual eyes, but it's changing families dramatically. Our health is extremely important, and the maternal child health is where it begins. So thank you all so much for this work. Like Councilmember Wansley, my office is here to help however I can and support you in this work. I want to congratulate you all on getting more money for this project. That's a big deal. So you must be doing something great if people are saying, take more money. Thank you all so much for this. I hope you have a good rest of the week. And seeing no further business before us, I'll declare this meeting adjourned.
The chief judge of the district court, and they consider changes people want to make to the city charter. Proposed changes can come from the City Council. They can come from voters who collect enough signatures of support for a proposed charter change.